Welcome, everyone, to the APAC's Health Summit. We are creating space for your mental health. My name is Dr. Christine Catapon. I'm the Vice President of the Asian American Psychological Association, and I am joined by my friend Jeannie Cheng, who will be joining me in this very important discussion. Before we begin, I'd like to hand things over to Representative Grace Meng of New York, who's been a champion on mental health issues for some introductory remarks.
Thank you so much to Apex for hosting this important health summit and the panel Creating Space for Your Mental Health. I'm pleased to send greetings to all who are attending. The COVID-19 crisis has been a very difficult time for our country. For many, the pandemic has caused increased stress, anxiety, and depression. And the impact on the AAPI community has been especially challenging, as our community has battled the rise in anti-Asian hate and violence. According to NYPD data, half of the perpetrators of anti-Asian hate crimes and bias incidents in New York City had a history of diagnosed mental illness. We must be proactive in ensuring that people can get the help that they need before they reach a crisis point. That means making mental health care available at our local community health centers and providing services that are linguistically and culturally appropriate. That's why I recently introduced the Mental Health Workforce and Language Access Act, which seeks to increase language access to mental health services at community health centers. My bill would ensure that community health centers have the resources they need to hire mental health professionals, so that language is not an obstacle to accessing mental health care. Our communities need the life-saving services that these facilities provide, and help should never be out of reach just because someone might not be proficient in English. It's equally important that we raise awareness and encourage people to access mental health services. Unfortunately, this is still considered a taboo topic in many corners of our community. To help combat these barriers, I'm co-sponsoring a resolution calling for the designation of National Asian American, Native Hawaiian, and Pacific Islander Mental Health Day. This measure, introduced by our KPAC chairwoman Judy Chu, acknowledges the importance of raising awareness of mental health, the challenges facing our diverse community in accessing healthcare, and improving the quality of mental health services for AAPIs. As we normalize conversations around mental health, our community will be more receptive and willing to seek mental health treatments. And let's not forget about the dire mental health issues that are being caused by the coronavirus pandemic. It has disrupted every aspect of our lives, from economic insecurity to financial instability, from isolation to the death of loved ones. These can cause serious mental health problems, which can worsen even further if individuals don't get the help that they need. So I'm also co-sponsoring the COVID-19 Mental Health Research Act, a bill to conduct and support research on the mental health consequences of COVID-19. Research and data are necessary for us to understand the scope of the issue and to create more effective legislation that addresses the needs of our communities. While we still have so much work to do, I'm inspired by APEC's ongoing efforts to address the mental health issues affecting our communities. I want to express my gratitude for the hard work that APEX is doing in this area and all that it continues to do on behalf of Asian Americans. Please be sure to take care of your mental and emotional well-being, and remember, it's okay to not be okay. Thank you for listening, and please stay healthy and safe.
Thank you so much, Representative Meng. So I'm going to throw it over to Jeannie, just so she can tell us a little bit about herself as well.
Sure. I'm happy to. I thought you were going to introduce yourself first, but I can do that.
Oh, yeah. Okay, well, hi, I'm Dr. Christine Catapon with AAPA.
Great. I'm Jeannie Chang. I'm the board chair of AMHC, Asian Mental Health Collective. And we're just so excited. We're just going to have a conversation. I think the best thing, when I was listening to Congresswoman Meng, I felt a little bit emotional, thinking about the last couple years. And my favorite thing to do is actually connect with fellow providers because it's been difficult, right? So We're talking about creating spaces for mental health. And what does that look like? But it's just a little bit about me, and then I'll throw it back over to you, Dr. Capitan, is that this is my third career, and part of, and I say that and people are like, oh, how old are you? So I'm just not going to reveal my age, but I decided to follow, and I call this my calling. When I was raising 4 young kids, a little bit lost in motherhood, and I wouldn't take that back. And I was staying in a home. I was a stay-at-home mom at the time, right after completing business school. But I asked the question, what am I passionate about? What are my strengths? What am I good at? The reason why I asked that, and I didn't know back then, that was all centered on my mental health, meaning what made me feel like I had a purpose. And, going back a little bit more, I started my career as a journalist. So it's funny now that I'm using all those skills, speaking, just really understanding what it's like to be in front of a camera, right? But then I went to business school, and I didn't go to business school for the right reasons. I went to business school because I wanted to look good. I was like, what makes me look good? Because I decided to leave the field of journalism because this is funny to say now, but in my early 20s, I was in burnout. And that's why I'm very passionate talking about that. I was just working so hard to prove myself. And then I lost all concept of like, why was I doing this? So in that sense, I could have prevented that, but I was like, you know what? I'm unhappy. So I chose to leave for my own mental health sake. And then I went to business school for the wrong reasons. But the reason why I'm sharing that is because I feel like all of that has come full circle to what I'm doing today. And I did decide to go back to school again and go back for marriage and family therapy. And that's what I'm doing today. And it's been very rewarding. But that's the reason I'm sharing this. Is so important to have had that purpose, because the last 2 years were extremely difficult, even as specifically first as a mom, 2 kids they actually went through COVID, had COVID. So I know firsthand what that's like, and then having to focus on that, but then treat many clients. Right. And so that's just a little bit about me, but I wanted to share that I'm just happy to be here today to have this conversation with you.
Oh my gosh. I so resonated with your story because I feel like it's very similar to kind of how I found this. So this is my second career. I was in pharmaceutical research for about 10 years, and I was burning out as well. And it was a very fast-paced, very glamorous job, traveling and all of these things, but I wasn't happy. There was a lot of diversity factors in play. And I just didn't feel like it was my purpose. And the way that I came into psychology was reflecting on my life. And, during one of my business trips, I'm like, if I could just help one little Filipino girl not have to go through what I'm going through right now, then all this pain would be worth it. And in my heart, I heard, that's exactly what I want you to do. And then everything got high def. It was literally like one of those epiphany moments. And I was like, what is happening? And so that led me to this career of, becoming a psychologist, and not just, like my vision was very small. I was just focusing on one Filipinx person, but that has led me to working with many Filipinx people, being the co-chair of the division on Filipinx Americans for AAPA, and now the vice president, and being able to touch so many lives, being able to do presentations like this with you, and just really emphasizing the importance of mental health. It really sounds like mental health is what got us here, but this is why we can so empathize with our clients, with our colleagues, because we know what it's like. There's like that concept of the wounded healer. And I think, you can just tell, the people who can really empathize with what you're going through. And when we're talking about AAPI mental health, how much more important is it to discuss because of the stigma? Like, what have you seen, Jeannie, when it comes to stigma? And
okay, so how long do we have? No, I'm kidding. What if when it comes to stigma? Let's go back to, because I resonate with the purpose of why we're here or why we're doing what we're doing. It did stem from the stigma I experienced growing up, Korean American, second generation Korean American. I bring that up all the time because I treat and work with a lot of Asian Americans coming from immigrant homes, right? And immigrant families, and just understanding that part of our identity is super important. But stigma, throughout, not being able to share the simple things of emotionally, how am I feeling? I'm stressed out. And, let's face it, the overture of parents of going, well, you shouldn't be stressed out. This is life. This is what you do. And I was like, okay, something wrong with me because I'm stressed out, and and a lot of what I do today, especially when I'm working with college students, is that very thing of validating our experiences and what we're feeling, but also understanding, because there's got to be that understanding of our culture, right? There's that constant reconciliation. I call that constantly reconciling what I call the imperfections of our cultural heritage, but that stigma, yeah, being part of that. And a lot of what drives me today is, I want to say, dispelling that stigma or trying to break through the walls
Yeah.
that, I want to say, it's so funny. I feel like every day we still build up. Even myself, right? There's moments I'm like, wait a second. Okay, am I falling into this again? Because there are patterns that I see, and I'm a family therapist. So it's amazing when I see these families intergenerationally weaved. Like, to me, when I speak to, young adults, I'm like, wait a second, that sounds like me, but 30 years ago, it's still the same. You know what I mean? So my thing is always unlearning and breaking those patterns, but it's a constant process. But stigma is the biggest thing. However, don't you feel like we're moving in a direction that's different because of the last 2 years? What are your thoughts on that? How has the
Oh,
pandemic
yeah.
shifted?
I do agree with you. It's really interesting because I thought when the pandemic happened, my practice would slow down. So I work at a university as well as have a private practice. And if anything, the pandemic has created space for people to become more aware of their mental health problems. And I think part of that is because many people like to distract themselves from their concerns. So we're workaholics. We party a lot. We watch lots of TV. We just don't want to think about the things that are like hurting our hearts. And when the pandemic happened, we lost our social connections. We
Mhm.
lost our ability to cope by hiking outdoors or doing fun things because of the risk of infection. And we might have been stuck with some of the people that were contributing to some of our concerns. So all of this combined to say, oh, wow, we no longer have life to distract us. We no longer have those social connections to help us cope with things. And now I'm faced with my mental health concerns. And when something like that happens, I think it was a real um, coming to awareness such that there the stigma of seeking mental health has been removed because everybody is seeking mental health. My
Oh, yeah.
colleagues and I that are in private practice, we're fully booked, and this is a good thing, and yet it highlights the need for more support and more representation. Um, yeah, I just opened up a slot like the other day, and it was filled the next day. So
I was
that
just going to say, isn't it? I don't want to use the word ironic, but almost the
yeah,
fact that 2 or 3 years ago, and just like you, I had a busy practice, so it wasn't like I was looking for clients or
right.
patients. But in the midst of the pandemic, the fact that we're so in demand is ironic, right? We're like, wow, and I don't know about you, but most of my practice, almost all of it is API.
Yeah.
That is sometimes I'm like, that's amazing to me and good, but then it does show me, wow, we are not enough. For me to say, I'm sorry, I can't take. It does still bother me when I can't take a certain client, especially if they're Asian, because I just can't. And there are moments where I'm like, I could, but really overextend myself. That's the self care that we need to. I cannot do that. I did that a lot last year in the end of 2020. That wasn't good for myself, right? If I don't have much to give to a client, that's not good, right? And so I
Yeah,
had to limit. Yeah, so I limit a little bit now and just take direct referrals. But the whole point is we're talking about the need of more API clinicians.
absolutely.
You know,
Yeah. I mean,
promoting
people want to know that, I'm not saying that AAPI folk can't meet with, people of other cultures, but
that point.
there's a certain comfort of not having to explain one's worldview. And,
Mhm.
I work with somebody who's not of my, cultural background, and that's fine. But I think for people who already have a stigma or a perception about therapy, having someone who represents their culture and can understand a little bit about where they're coming from and not question some of the values we have, it can mean everything. And
Yeah.
you are talking about the fact that we need more representation. I think, the Asian American Psychological Association, we have like hundreds of members and we are national. And yet I don't know that there's like enough like awareness in promoting your company and promoting our organization to let people know that we are here and that we exist. And another thing that you were touching on was, you know, there is a second mental health crisis that is happening, not just for our clients, but also the practitioners, because as as we identify as AAPI, a lot of the events in the last few years, and particularly in the last year with Stop AAPI Hate, I mean, we are going through some of the same things that our clients are going through. Plus, we're being asked to provide more and more support when our resources are already pushed thin. And that's not to say we don't want to help people, but it's been a mental health crisis for practitioners as well, who are trying to process the same things that our clients are going through. And that's why
Yeah.
we need to create space for
Mhm.
mental health, for self-care. It goes for both the clients as well as their clinicians.
No, and I'm glad you brought that up, the second mental health crisis,
Yeah.
because that is extremely important. Actually, the work that I do with AMHC helped me to, because in some sense, the work I do is clinical, right, treating clients, but then I'm also a speaker in the workplace promoting workplace wellness and mental health.
Mhm.
That during the time of right after the Atlanta tragedy, I don't even remember how it was so crazy for
Yeah.
me because I was asked by corporations left and right to speak. So you're kind of in survival mode going, I want to be there. I want to help them. And I'm speaking to employee resource groups, Asian employee resource groups, diversity, equity, inclusion leaders. And so it was great to be part of that, to provide that support.
Mhm.
I think I remember, and this is me sharing this. This is the space that I created for myself. There was a talk that I did on a Zoom, and I think I recall maybe like 100 or so people on the Zoom for a corporation. And
Mhm.
someone asked me, because I was talking about model minority stereotype, Asian identity, and someone asked me on the Zoom chat going, well, how are you doing, Jeannie? Because I know that you kind of just had to go right into crisis mode. Now, I was like a little bit, I just, I'm talking on a slide. I go, whoa, I just saw a question. And it took me a second to pause and I got emotional, but that's the vulnerability and the strength that I needed to express a little bit of that going, thank you so much for, asking that question. Yes, it's been difficult, but I love what I'm doing. Look, I'm getting emotional talking about it. But the whole point was that person created that space for me.
Yeah.
I took advantage of that space. And even in the midst of hard work, what I'm sharing is it helped me to be vulnerable about what I was feeling. And and it was only a snippet of going, yeah, it's been difficult, but I'm so glad I can do this. And thank you for asking. And then I moved on. But I don't know why I still remember that moment. And that's me just sharing, even in the midst of the difficult work that I created that person asking me, and I created my own space to take advantage of going, I'm going to answer that question. And I did. And it's clearly like I had to wipe away a tear. That's fine. But that my volunteer work is what's sustaining me in that sense, with Asian Mental Health Collective, and I'm sure you. But overall, we have to keep each other accountable, though. Like, how are we taking care of ourselves, right? Someone even said,
Yeah.
"You don't have to say yes." I go, right. I don't need to say yes.
Yeah.
Thank you for that reminder, phone
Mhm.
or whatever it is, to feel like we have to say yes to everything.
I think creating space is such a challenge though, because at least for me, I'm like, I have positions, I have work, I have jobs, I have all of these things in my life, and we don't often create space. And what I find unique for some people of color is that we don't notice that we are burning out until the psychosomatic symptoms hit us. And what is that? That is the physical stuff that makes us go to our physician and say something's wrong with me, and they say nothing is on the labs. It's probably anxiety. It's probably stress. So it was really interesting that week in March when the shootings happened. I was grieving the loss of one of my best friends to COVID. I was grieving the loss of another uncle to COVID, and my dog.
Oh
And
no.
then the shootings happened, and in the middle of this, I was helping prepare statements, because of the shootings, and just like all of this correspondence, and things requiring my attention. And darn if I had no space to process any of it. And so my body made space for me by making me sick, by taking away my voice, because I will work through a cold or whatever, because I'm on Zoom. I'm not going to spread it to anybody, but you take away my voice, I cannot do my work. And I had laryngitis for a week. I was forced to rest. And I'm really hoping that the people who are listening to this, it's like, sometimes we will not accept, sometimes we will not recognize when we are in a mental health crisis, when we are overwhelmed. And so, Jeannie, I'm wondering if both of us could kind of talk about the things to recognize, because for me, I get really hit with illness when I have not created space to rest and recuperate, and if I'm doing too much. Like, what do you see in your
I resonate with everything, with the physical things too. Psychosomatic, meaning all the physical manifestations of our emotional distress. I'm going to add to that, but then I'm also going to share. I'll share first, and then I'll add to that the psychosomatic symptoms. But irritability, going from like 0 to 100, I found myself doing pretty often with my family. Now, clients, I'm like, Jeannie Chang, with my family, which they're also in high school and college, they're difficult too. They had their own difficulties of trying to navigate the pandemic as students. I just found myself, I had no patience. But I was irritable. And I know that also, by the way, I tell folks, can also be a symptom of depression too, when you're just grumpy, grumpy like the drawer. I was thinking of the grumpy drawer, I was that person because I didn't have that space when I was busy working, right? Behind the scenes, I'd just be like, and I'd be like, what is Jeannie Chang? Get your act together. So that I wanted to share that. My emotional stress came out a lot in the family. And that's just not good, right? You're hurting the people that are there supporting you. But obviously we got through that. But physically speaking, wow, I just hearing you being vulnerable. I lost some hearing. So I have
tools.
Yeah, I have Meniere's disease. It's just an allergy of the inner ear that I always maintain well, but stress aggravates it. But the month of May, which is my busiest month, I don't know about you, but it's API Heritage Month, Mental Health Awareness Month. I was boom, 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 and I ignored symptoms. I actually chose to ignore them. I'm like, oh, this buzzing sounds strange. I don't think I'm supposed to have a buzzing and not supposed to hear, but oh well, I kept going. But by the time I got to my ENT, audiologist specialty, I have all the doctors. They said, and I'm not going to mention how much hearing I lost, but I do now have a hearing aid. I'm sharing the story not to dramatize it. It's just that I made a decision that obviously I'm not going to say I regret it because I did my work, but I chose to ignore symptoms. Now, thank goodness it was not more serious, but a hearing aid does help me hear better because I had profound hearing loss due to the stress on my body. Why am I sharing that? Because as you shared, it's going to take a toll when we don't create our own space for mental health. And I always tell people, I know I'm a provider, I'm a clinician, I'm a human being first. So, I mean, I'm going to be real. And so, yes, I'm not Superwoman, and that's what happened. And that is the manifestation of the pandemic, and that's fine. But I've kind of reconciled it on my own, but I wanted to share that and just, wow, I guess that came out.
How interesting. With the two of us, one loses her voice, one loses her hearing.
Yes, but we are still surviving, as you can see.
Yeah.
But yes, and then speaking of our work, I mean, I guess as we pivot a little bit so we can provide those resources, I'll also share this in the middle of that. Yes, it was right after the Atlanta shootings. AMHC, Asian Mental Health Collective, the demand for it went through the roof, meaning, okay, what can your nonprofit do? We just literally became a nonprofit November 2020. So then March 2021, we were like and I had just came on board as the, board chair and president. And I was like, what? Okay, what do we need to do? And they were like, I don't know, but we're getting lots of requests. So we already had a directory of API clinicians or API therapists, whoever wanted to join the directory for free. But we literally had to put things in overdrive and do our website and find sponsors. But the good thing was, because of what was happening, sponsors were coming to us saying, how can we help you build out your website, expand this directory that we needed a little bit, honestly, more user-friendly. Somebody in, let's just say, the Midwest going, okay, I am here in this small town. What's the closest therapist? and I want a male, and I want, and they have to put specific, we have all that in now. So I want to share that we have this therapist provider directory that's I would say that we really want to emphasize that's there for, and we really made it user friendly, because it's not hard, it's not easy to find a therapist, right? And we can talk about what that process is like, but at least you can go to a directory and put in filters. I think that's the word I want. Filters, like you're filtering through what you want for a therapist, but you should. We talked about this, Dr. Capitan. I'd like you to expand on that.
Yeah, AAPA is also in the process of developing its provider network and having a list available on our websites, because we recognize the need. And yet there are so many people like, oh, we don't want more clients because we can't accommodate. But there are a lot of AAPI folks that we haven't been able to reach. And so hopefully this video will say, hey, there is a community. There are organizations for support. I know we're just two of them. There are so many more out there who are really emphasizing the need to support mental health for our community. When I'm referring people off campus, because we have short-term therapy limits on college counseling, because there's usually like 30-something thousand of them. There's like 30 of us, so we can only do short-term. But I often recommend, if people are going to use their insurance, use your insurance. Like there is no taboo or stigma. Your employers are not really going to, depending on your area of work, they're not going to care that you are in therapy. That's not going to be part of your record. This is all confidential stuff. And so I encourage people to use their insurance, because paying for out of pocket therapy is not always an option for people. And I encourage people to Google those therapists. So go onto your insurance, look for the therapists who take that insurance, and then Google them, because they will have some kind of website. They will have a Psychology Today profile, and you can read their approach. You can read and see their faces and see what kind of insurance they take, what kind of, approach they have, and do your research. You are the consumer, and you have every right to shop around until you find the therapist that works for you. I can't tell you how many nightmare stories I've had of people who stayed stuck with the therapist that wasn't a good fit because they didn't know that they could do that. So you are the consumer. You have every right to shop around until you find someone who helps you feel accepted, connected, not judged, and actually can help you move through whatever is going through. So that's like my main thing. How about you, Jeannie?
I'm glad you shared that. No, I love that word shop around, because we should.
Yeah.
What's the best fit? And then I'll add to that. Let's just say you feel like you found a therapist that works for you, but somehow after a few sessions, maybe not, which what I've heard as well.
Yeah.
Then I think it's important, instead of going through the session and then feeling like or sessions and feeling like it's not productive, or you're just not feeling the connection, please mention it. Now, of course, you may be afraid of hurting your therapist, or I understand all of that. But the thing is, the last thing you want is just to go through something and then realize therapy was not productive because of that experience. Does that make sense? Because I'll get clients like that, and I'll be like, okay, so I make a concerted effort, and this is therapists who are watching, maybe just make that effort to also mention, hey, if this is not working out, I need you to tell me, or I need you to, how's this going? I'll even say, how's it going? And I think that's important to do a check-in with the client, and know that sometimes they'll say, well, this didn't work, or, and collaborate with them. And if it doesn't work, you refer them, or client, if you're listening to this, find someone else and just be like, I'm sorry that, I need to find another therapist. Or if you, here's another thing, you can make something up. I tell clients that, I go, listen, if it didn't work, they're not going to know.
Yeah.
Honestly. And I'm saying this is like the inside scoop here. I'm telling clients, but I'm saying that because I've seen so much distress that I'm like, I need you, because friends telling me, Jeannie, this is not working. I'm like, can't tell them. I can't tell them. I'm like, all right, then you think of the best thing you can think of. Just don't dodge emails and calls. I mean, after a while, I think that's not productive. But yes, you need to find somebody, even if you have to switch, or it's not working for you, or you feel like you don't need the therapy anymore. That's okay too. That's important. Yeah.
You graduated. Great.
Yeah,
The last thing
we want you to move on.
Right.
Yes, I tell people that.
And we want people to have a positive experience with therapy. I think there have been times where people come like to one therapy session and it didn't work out because it wasn't a good fit or what have you. Like, see, therapy sucks. Let's tell everybody about it. Like, everybody talks about like the negative experiences that they had, but nobody talks about the positive experiences enough. And until now, until this pandemic, it's like, wow, this has actually helped me. But, people have the right to feel safe in therapy. And so I encourage people, if you feel like you're being asked to do too much, if you're feeling unsafe, your therapist can handle it. We have been trained to know how to do this, and it's okay. You don't have to worry about taking care of our feelings. We're here to take care of your feelings.
Yeah.
So,
I love that you shared that. So
yeah.
you hear it from here. We won't get offended. And if
Yeah.
anything, we need to know, I was going to say also, because I work with a lot of any corporate folks watching this, you have EAPs, employee assistance
Yes.
work. That's important to take advantage of because I believe they give you at least 4 to 8 sessions free. And that's part of your package as an employee. And you should take advantage of that. And there are EAP therapists that are connected to your work. And everything is confidential. So it's not like it'll be found out. No, it's not about that. It's just that take advantage of free sessions. And then obviously, if you have a cap on the sessions, then you can decide whether you continue with copay. And you're right, copay is very minimal. It can be I've seen it as little as $25 to more, but still going in network always helps.
Yeah.
But so that's one thing. That's for corporate folks. The other thing is, Asian Mental Health Collective has now. Let me do the best way to explain this. I don't always endorse social media. However, a way of connecting, if we're talking about the Asian community, there's something called Subtle Asian Mental Health Facebook group. That has helped some folks that are not ready for therapy. You want to be ready, right? You don't want to just go because someone forced you or someone told you. If you feel like you're not ready for that, there are Facebook groups such as Subtle Asian Mental Health where you can ask questions or even feel like you're part of a community just talking about mental health. Hey, what did you do when you fought with your mom and you wanted to, and I see all these questions a lot and people chiming in. You'd be so amazed to seeing the community of folks around the world on a Facebook group. And I share that because that's also an extension of AMHC. And that's actually how AMHC was created.
I didn't know that.
Yeah, from that, it's about 60K folks now, but it's amazing to see. I don't go on there all the time, so then I get overwhelmed when I see all the questions, but it's a great place to start. And then I also want to do this because I want to not forget this is super important for people who cannot afford therapy or honestly maybe are under their parents' wing and they can't get a copay. Let's be safe. We have something called the Lotus Therapy Fund. You can apply for free therapy sessions. And we have clinicians part of that fund that's funded by sponsors that will be able to treat you depending on the city you're at. Meaning you have, I believe we give out 8 to 10 free sessions to start. And that's something we just created in 2021, thanking our sponsors for doing that so we could pay our clinicians, but no cost to the client. So I wanted to share that because that's important. Yeah, we're really proud of that program.
Is that nationwide?
It's nationwide and in Canada. Yeah. So we want to share that. And that's something that came out of the Atlanta tragedy. And then we just put it in full gear. But it's again, thanks to sponsors. And actually, I believe now we're going to expand on it because right now we have 2 cohorts going on at the same time. I think we're going to double that. Because we got as you can imagine, Dr. Cavadon, we got a lot of applicants. Yeah. So we want to make sure we meet that need and find the therapist for them around the country.
I think when we're talking about alternative resources too, I think mental health doesn't always have to come in therapy. I mean, it's great. I mean, I'm so glad to hear that we have these resources. I think also reaching out to our local community centers is a great resource. I know there are quite a few, like for example, Philippinex community centers in Los Angeles who do offer group therapy or community discussions. Sometimes you can just even attend workshops that are being offered in your area or online to learn more about mental health resources is really important. I do think that there's like a big trend on TikTok as well, but I'm not a huge fan of TikTok mental health only because, people are speaking to their own experiences, but that's their experience and it can't take into account your own unique experiences. So rather than diagnose yourself, just talk to somebody who can actually give you some clarification, because I'm hearing a lot of people like misdiagnose or overdiagnose themselves, and that can create a lot of distress as well. So I would take it for entertainment purposes, and if it resonates with you, go talk to somebody who will be able to support or confirm or deny um, any of those things.
I think that's
I've tried quite a bit.
yeah, always. I know it's so funny because yes, I glance at TikTok and I'm actually on TikTok for something else, which I'll share about in a second. But I do think it is important to seek a professional when you feel the need to get the professional feedback or advice or direction, if that makes sense, right? But you're right. I mean, social like Facebook groups can be support. Some people, and I kind of put that very gently, saying you may not be ready for therapy. Sometimes I'll get clients being like, "Yeah, so I was told to come here."
Right.
And you want to be able to have the client also have that motivation of wanting to be there as well. So sometimes it does go both ways of the client being ready. And it's funny when they say that, because usually it's teens or college students or something, and they come in and they're very honest with me. But I think that's important to know if you're ready or not, and not feeling like some people have told me I need therapy. I've heard this too. I'm like, well, do you feel like you do? And they're like, I don't think so, but that's what they're telling me. I'm like, what are you, look at, sometimes we're listening to everybody else. I'm like, no, what do you think? Right? What are your thoughts on that? But yeah, I shared I was on TikTok. No, let me explain. You're like, Jeannie, what are you on TikTok? No, not giving mental health advice, but when Congressman Meng, she opened up just earlier today saying it's okay to not be okay.
Yes.
That is the name of a K-drama. Okay, a Korean drama. Do you watch any, Dr. Kaplan?
I have.
Okay.
Here.
Okay, so I use K-dramas in my work. So that's why I'm on TikTok. So I actually do use Korean dramas to help people understand mental health. And I brought it in, I would say accidentally 3 or 4 years ago in a college workshop, and it stuck. So I break down Asian identity through that and emotions. And yes, I just share that because when she said it's okay to not be okay, I cracked up going, oh yeah, that's the name of a K-drama that people love. So
check that one out.
What I'm saying is Korean dramas can also provide some outlet. That's the escapism too. Obviously moderation. I'm saying that here, moderation, but it can be a great source of just expressing emotions that you didn't know you were feeling. And so I just have to say that. I'm glad you watched it.
Well, it's funny because I do work with a lot of college students, and I will use Marvel, I will use DC, I will use Harry Potter, I will use, whatever YA thing is happening nowadays. And I say that it's a good excuse for me to be up to date with those things. But, it really is my self-care. And if it can help other people, so be it.
Yes, exactly.
As we're coming down to the end of our conversation, I can't believe we've been talking for this long. And I'm sure this will not be the end of our conversations with one another. If we wanted to emphasize any takeaway points that would be important for our viewers to know about creating space for mental health, what do you feel like the most important things would be?
Well, I want to say, I do like saying this because there's a saying of in Korean too, but following your own gut too on how you feel about things. We get very swayed by other people and what people are saying to us, what social media says we should be doing. And I know mental health is such a priority for many people, but the bottom line is, how are you feeling? And just know that you can also figure out what works best for you. Yes, we're talking therapy, and yes, we're providers. But you said it. It doesn't necessarily have to come in those forms. Mental health, creating a space for yourself should be an everyday thing. People think it's an end goal. It's not an end goal. It's an everyday goal. I have to remind myself every day to take a time out, or not keep reading emails or TikTok. No, I'm just kidding. And put myself and take that. It's boundaries, establishing those boundaries, which I think is in Asian culture sometimes are a little bit harder to come by, and we're not ingrained to think boundaries, keep them clear and not enmeshed. But I work hard, and I'm sharing this honestly. I work hard every day to do that, and that's what we should do. Creating mental health space for us every day is mindfulness. Just being very mindful of mindful living every day. But people tend to think of that as the end goal, and I don't want that, because that's you going, I've reached my max of stress and I'm burned out. Now I'll take care of my mental health. So what I'm trying to say is be proactive, and also think of it as daily. That's my word, daily mental health hygiene. I mean, we're so good with physical hygiene. I mean, I took care of myself, did my hair, but it's like mental health. It's your hygiene, mental health hygiene. What are you doing every day to take care of that?
That's great. I love that. What I would say to explain therapy, because I think a lot of this is about psychoeducation and just explaining what the process is. This isn't about somebody trying to tell you what to do and how to live your life. I often explain to my clients, you are the expert on you, not me. You have your own inner wisdom based on your upbringing, your cultural values, your experiences. And I'm kind of like the person who has all the education who can give you options for how to do things if you are thinking things that are hurting you, if you are doing things that are hurting you. I have a ton of options you can try to consider. You try them out, you see if it works for you. And I really do believe it's about empowering our clients to use their own wisdom, use their own resources, to realize that you've had the answers within you all along, and that we as providers want to respect that. We're not going to try to undo your values. We're not going to try to minimize your culture, because it's a big part of who you are. But we want to help you push past the barriers that are keeping you from accessing and being your authentic self in all areas of your life, with your family, at work, what have you. So I do hope that you'll take the time to reach out to talk to somebody. We're two examples of the kind of people you can talk to, but there's plenty more. And we thank you so much for, listening in, hearing what we're sharing here. Hopefully, it's resonated for some of you, and to know that we're all going through this together. So let's uplift one another. Let's support one another with all of our strengths and all of our skills. And we thank you again so much for being here today. Thank you. Thank you, Jeannie. It was lovely talking to you.
Thank you so much. I love this conversation.
Yeah.
Can't wait to see you guys soon. Bye, everyone.
Bye.
Thank you so much for joining us today for our Apex Healthcare Summit. We'd also like to thank our event partners for supporting us in all of the work that we do, specifically Biogen, DaVita Pharma, Amgen, Quest Diagnostics, Novartis, Novo Nordisk, ACS Can, AmerisourceBergen, BMS, Campaign for Tobacco-Free Kids, and Grail Bio. Thank you so much for joining us, and we look forward to seeing you the next time.